Thank you. Members, mental health is not confined just to the cement sidewalks and asphalt that we have to live on here in the Capitol building, in the Capitol itself. There are just as many problems out in rural Colorado as there are here. You may not see them because ag people are very stoic. It's one of their biggest assets is they never let you know what's going on. But it's also one of their biggest problems. You know, a guy can have the best season he's ever had, the biggest harvest that maybe his family has had in history. When you see him at the feed store or at the parts store or at the grocery store and ask him, how did it go this year? Oh, better than I hoped, better than I thought. They don't brag about it. If you see them a year later, and it's been a drought, it's been a hailstorm, it's been a tornado, it's been whatever else can happen to agriculture, and you ask him, how'd your season go? Well, not as good as I had thought, not as good as I had hoped. Those two different responses, in passing, any of us would say, oh, they're fine, everything's good. But in reality, they may not be. I was a banker. I was an ag banker for a number of years. Back in the 80s, when ag was failing. I had customers that ended their lives because they were the ones that were going to lose the generational farm. Been in the farm 5 generations. And he felt responsible for having lost it. It didn't have much to do with his management skills. It had a lot to do with government, it had a lot to do with markets, it had a lot to do with outside issues. This program was not in place when I was an ag banker. Since I've been in the building, right at the time I got here, we started the ag health care through the Department of Ag, and it's been successful. Anytime we in this building can bring more emphasis to the mental health of our citizens, I think we win. And coupling the Ag Department and the Health and Human Services Department, in my mind, makes a lot of sense. It may not be as big a deal to you as it is to some of us. But when you read obituaries in a community of 500 people and you don't know what caused them to pass, it rocks the whole town. If it was natural causes, people know what to do. If it's not, it's very hard to respond to. It's very hard to show care and love, other than to hold them when they're crying. And by that step, it's too late. Now you've got problems that permeate through the family. Folks, this is a good idea. I don't want to get carried away and eat up all of your time this morning, but I need you to understand this bill will probably pass anyway, but you need to know how critical this is in communities that know each other for generations. And then not be able to talk to the kid they grew up with because they don't want to say, I'm not doing well. But the ability to tell a stranger I'm not doing well is sometimes easier for us than it is to tell a spouse or a child or a best friend. We need to open the doors, folks. We need to have an ability to reach out, for them to reach out. And the other thing that you might want to think about when we're thinking about this bill is that if a young man is worried about his dad, this is a place to go. Or for a dad who's worried about his kids, for him to go to find out if there's something he can do or if there's something that can be done. There isn't one of these facilities on every corner in every little town. We need to open these doors as quickly as we can because it's like an epidemic out there. It's just not well publicized. I want to thank the sponsors for bringing it. I want to thank you for voting yes. Good bill. Vote yes.